Good morning, good afternoon, and good evening, everyone. My name is Chikako Masaki from Sasaka Health Foundation. Thank you for joining us for today's webinar. This is the fifth in our series entitled Elimination of Leprosy, Initiatives in Asia. Dedicated efforts have been made to address the medical and the social issue of leprosy. Today, we will focus on initiatives in Asia. We hope that this webinar will be an opportunity to reflect on the importance of these issues. I now would like to welcome our special guest, Mr. Talindas, the chairman of Sasakawa India Leprosy Foundation, to provide his message. We got the video message from him today.
It's an honor for me to speak at this webinar series commemorating the 20th anniversary of our patron, our inspiration, Mr. Yohei Sasakawa, WHO Goodwill Ambassador. He has been a pioneer in the field of leprosy, and we are privileged in India and indeed all over the world to follow his example. The campaign, Don't Forget Leprosy, is significant because COVID took attention away from other diseases, including leprosy, and we have to remind ourselves that leprosy continues to be a challenge, continues to be with us in the post-COVID pandemic time, and we have to make sure that we can stick to the mission of early case detection, addressing the issues of disability, making sure that multi-drug therapy is available for treatment, and all of that. So this webinar particularly addresses elimination of leprosy initiatives in Asia, which accounts for the largest number of new case detections. Asia, and in particular Southeast Asia, deserves special focus and special attention. So I congratulate the Sasakawa Health Foundation for organizing this seminar and bringing us all together. I want to mention the particular initiatives taken in India because it may be relevant and it may be useful for others in other Asian and Southeast Asian countries. In 2006, Sasakawa-san took the leadership in setting up the Sasakawa India Leprosy Foundation, SILF, and also the Association for Persons Affected by Leprosy, APAL. These two institutions, which were set up, have played steadily a growing role in the field of leprosy. SILF, for example, provides scholarships, provides skills training, provides assistance for livelihood programs for persons from the leprosy community. SILF today is also providing humanitarian assistance in the colonies so that the quality of life, the standard of life of persons living in these colonies can be improved and they can be more empowered to be able to take on skills training, livelihood projects, and educational scholarships. Association of Persons Affected by Leprosy brings together people from all over the country And APAL, which is headquartered in Hyderabad, has state leadership and organizations around the country. The most important thing is SILF and APAL are working together at this time more and more. And APAL office bearers are on the advisory board of SILF so that that connect, that cooperation, that collaboration exists between the two institutions which were set up under the leadership of Sasakawa-san. All of us at this time must renew our efforts, drawing inspiration from Mr. Sasakawa. I congratulate Sasakawa Health Foundation to connect all of us, to keep the Don't Forget Leprosy campaign in the forefront of our minds. And I hope that this webinar is truly successful in achieving its purpose. We in India, and particularly SILF, commit and recommit our energy, our resources, our efforts to work diligently and consistently to support the persons affected by leprosy, to help to mainstream them into society, and to do all that we can with the inspiration and support of Sasakawa-san to make a difference and to make sure that we never, never forget leprosy. Thank you.
Thank you very much. This message reminds us how important it is for us to work together to address the remaining challenges. Next, I would like to share with you the WHO Goodwill Ambassador 20th anniversary video, Elimination of Leprosy initiative in Asia. Please show the video.
Elimination of Leprosy, Initiatives in Asia. Beginning of support for leprosy work in Asia. In 1963, Yoichi Sasakawa, father of WHO Goodwill Ambassador for Leprosy Elimination, Yohei Sasakawa, established the Nippon Foundation. Looking at the leprosy situation in Asia, he declared that Japan needed to act. Beginning in 1967, by subsidizing the construction of a leprosy center in Agra, India, known today as the National Jalma Institute for Leprosy and Other Mycobacterial Diseases, he started supporting construction of leprosy facilities as well as other activities against leprosy in various countries. Activities in Asia. In 1976, construction of the Korean Leprosy Institute was completed in the suburbs of Seoul, South Korea, funded by Yoichi Sasakawa. Yohei accompanied him to the completion ceremony. There, Yohei saw for the first time the desolate situation of leprosy patients and was shocked. Watching the way his father treated them with kindness and compassion, he vowed to make leprosy his life work. In 1986, in response to Yoichi's wish to eradicate leprosy, Yohei launched a campaign to raise 870 million yen in honor of his 87-year-old father to fund the building of a leprosy research center in Thailand. It was named Sasakawa Research Building.
最初のこのワクチンを作った大阪大学の伊藤利太郎先生が WHO の本部でね、笹川良一にハンセン病のワクチンの試薬を打ったことがありますが、この伊藤利太郎先生を所長としてタイに行っていただいて、活動を開始した途端にですね、タイ国では爆発的なエイズの患者が激増し、アジア各国でも問題になりまして、何としてもエイズが優先だということで、私たちのこの夢がですね、ハンセン病研究所が本来ならばタイに存在してたわけなんですけど、これがなくなってしまったというのは大変残念なんでございますけど。
In 1994, the first international conference on leprosy control was held in Hanoi, Vietnam. with the participation of 28 countries that had yet to achieve leprosy elimination. At this conference, Yohei Sasakawa announced that the Nippon Foundation would fund free distribution of the drugs used to cure leprosy for 5 years from 1995. Free distribution of multi-drug therapy accelerated efforts by governments, NGOs, and the WHO to achieve the WHO's target to eliminate leprosy as a public health problem by 2000 and contributed to various countries in Asia achieving this goal. Elimination of leprosy in India. India has the largest number of leprosy patients in the world, and it was expected to face many difficulties in achieving elimination, which was defined as a prevalence rate of leprosy of less than 1 case per 10,000 population. In 2002, the Tokyo Declaration to eliminate leprosy in India by 2005 was adopted. Between 2003 and 2005, Yohei Sasakawa visited India 13 times in support of this goal, which the county achieved at the end of 2005. At the same time, the first national conference of persons affected by leprosy was held in the capital, New Delhi, bringing together people from leprosy communities around India. At this conference, the decision was taken to establish a networking organization called the National Forum, now known as the Association of People Affected by Leprosy, or APAL, to work for the socio-economic empowerment of all those affected by the disease.
私は大使に就任するまではどちらかというと回復者の皆様方にも援助をすると。で、常に回復者の皆さんはその受け手として存在してきたわけですけども、これでは私は問題解決にならないと。常に支援を受けて生活するということがセルフディスクリミネーションの原因にもなっているわけなんで、私たちはこのように立派に病気が治って活動してますよということを広く国民に知っていただくことが重要なんで、そういう意味で回復者の皆さん方に声を上げてくださいと。彼らは長い間の厳しい差別の中で、ここで自分たちが声を上げればまた新たな差別を受けるんじゃないかという恐怖心を持ってたわけですが、そんなことありませんよ。そうじゃなくて、こんなに私たちは病気治って元気に活動してますよということを広く国民や行政の皆さんに知ってもらうことによって、ハンセン病に対するイメージが変わっていくわけですから、これからは回復者の皆さん、あなた方がこのハンセン病をなくすための、そして、偏見や差別をなくすためのリーダーとして活躍する時代になったんですよということで、APAL を作らさせていただきました。
In 2006, the Sasakawa India Leprosy Foundation, SILF, was established to help persons affected by leprosy to become self-reliant. It partners with the Confederation of Indian Industry, NGOs, academic institutions, media, and others in this effort. SILF's core activities include promoting employment opportunities, providing small loans for businesses, and offering scholarships for children. In 2014, His Holiness the Dalai Lama visited the Tahirpur leprosy complex in Delhi with the Goodwill Ambassador. Out of this visit grew the Dalai Lama Sasakawa Scholarship Program to support the higher education of children from leprosy-affected families. SILF serves as a secretariat.
ハンセン病の回復者がその孤児期をしないでもね、生きていける、孤児期をゼロにするということが私の大きな目標なんだということを言いましたら、ダライ・ラーマさんが「笹川さん、それは不可能ですよ」とおっしゃったので、芸かお言葉を返すようですが、不可能かどうかは活動してみなきゃ分かりませんよと。頭で考えてそれは無理だ、できないというのでは問題の解決にはならないんじゃないんでしょうかって言ったら、なるほど、それは笹川さんの言う通りだと、私も協力すると。で、私もいろいろ本を書いてるから、その印税を給付するから、子どもたちの奨学金を作ろうじゃないかというようなことで、ダライ・ラマさんのお金をいただいて、ダライ・ラマ笹川奨学金というものを作って、今優秀な子どもたちがそれを 受けて勉強していらっしゃる姿については逐次ダライ・ラマさんの方にも報告をさせていただいております。
What the ambassador has seen. On a visit to Indonesia's Papua province, the ambassador had dinner with a man who had been forced from his village and was living alone. In Bangladesh, he visited a Rohingya refugee camp to check on the humanitarian situation there. In Nepal, he traveled to the Terai region and saw large numbers of leprosy patients who had crossed over the border with India for treatment. In the Philippines, he attended ceremonies to mark the centenary of the establishment of a leprosy colony on the island of Culion and the opening of a museum and archives. The archives was subsequently inscribed in the UNESCO Memory of the World Register, Asia and the Pacific in 2018. At Sungai Buloh Sanatorium in Malaysia, he met with 5 representatives of the residents' committee to hear from them about issues concerning the survival of the sanatorium. In Timor-Leste, amid the fragile security situation, he received a briefing from the WHO country representative beneath a ceiling damaged by riots. Timor-Leste achieved elimination at the end of 2010. He journeyed to remote island nation of Kiribati, which has a high prevalence rate of leprosy, to learn about the challenges faced by a small island state.
まだまだ私の働きが十分だとは思っておりません。神から与えられた罰であるとか、遺伝する病気だとか、大変伝染性の強い病気であるとか、その MDT が出るまではこの病気を治す薬がなかったんです。したがって人々のこの頭の中にハンセン病に対する悪い印象の DNA がみんな残ってんですね。でこれを取り除くためにはこれからもさらに努力が必要ですが、
Thank you very much. So let's move on to the next part, presentation. In this session, the 4 presenters share their perspectives on challenge of leprosy in their countries and what of the leprosy issues should not be forgotten. First, I would like to welcome Ms. Ellen Lemon, National Leprosy Elimination Program Manager of the Ministry of Health and Medical Services in Kiribati. We got a video presentation from her.
So the 5th webinar of WHO Goodwill Ambassador 20th Anniversary Campaign. And hi, my name is Lady Mon. I'm the National Leprosy Program Manager from Kiribati. First of all, I would like to thank Sasakawa Health Foundation for inviting Kiribati to the 5th webinar of WHO Goodwill Ambassador 20th Anniversary Campaign. And I am so honored to be one of the participants in this webinar. Before I proceed on to our main topic in my presentation, please allow me to take you through to my beautiful island, Kiribati. Kiribati is just one among the smallest countries in the world, located in the Central Pacific Ocean. It is very hard to locate Kiribati on the world map, as it is just like a tiny dot. On the slide in front of you is the map of my country, and that is how the tiny dot on the world map looks like in reality. As you can see on the map, Kiribati lies along the equator, and the islands are distributed across the ocean. It comprises of 32 island atolls. Among the 32 atolls, only 23 are inhabited. Again, for Kiribati, we have a total population of 490,000 people. This is according to the national census in 2020. We have a total land area of 811 kilometers square. The population growth in 2020 is 1.6%. Population density is 147 people per kilometer square. But on South Taro, which is the main capital of Kiribati, it has 65,000 186 people over 15.76 kilometers square. We have 4 main hospitals in Kiribati, and there are 114 health centers or clinics altogether, and 1 referral health center for leprosy. In the next slide is the National Leprosy Elimination Program Unit. And as you can see on the slide, there's a program structure. It's a leprosy program structure. And from the very top is the dermatologist, the National Leprosy Program Manager, and 2 leprosy program nurses. So we have 4 of us in total who run the National Leprosy Program in Kiribati. On the other side is what kind of services that provided from the National Leprosy Program. We have 3 main services like outreach program services, skin clinic, referral center for leprosy. Now we come to the leprosy situation in Kiribati, and as you can see, we have the data here from 2016 up to 2021. I think I don't have to go through one by one as the figures are already in front of you. But that is the leprosy data from 2016 to 2021. Since we are all working toward attaining the WHO target of decreasing the prevalence rate of less than 1 case per 10,000 population, the line graph shows that Kiribati has the prevalence rate of more than 10 times above the elimination target or WHO elimination target, and therefore leprosy remains as one of the public health burdens in Kiribati. Previous slide shows the total number of new cases detected every year from 2016 to 2021. And in 2021, there is a total of 155 new cases being detected after the implementation of the activities. So on the slide, you can see the list of activities that has been carried out in 2021, and that's how we get our total new cases of leprosy. So the national program focused mainly on early case detection activities, and that include the update training of health staff, awareness campaign on leprosy, out island visit, school screening to early detect new cases. From the list of activities implemented in 2021, the table on the slide shows the summary findings of outreach programs. It also shows the number of islands visited and also shows what kind of early case detection activities conducted in each island visited, and as well as the total number of new cases detected from each island. As you can see, there are 15 out islands of the total 23 inhabited islands, and we managed to cover in 2021 with the total number of 44 new leprosy cases being detected. This slide is the continuation of summary of findings, continuation from the previous one. Capacity building of health staff is also part of the outreach programs to the community where the health staff were capacitated with leprosy program so that they could be able to detect and manage leprosy at their respective areas. The table shows the total number of health staff trained on leprosy. Sorry, like as you can see on the slide, we have a total of 299 health staff. This includes MAs, public health nurses, and SA, and we managed to train 180 out of the total number from the islands that we visited in 2021. One of the outreach program is the follow-up of defaulters. By looking at the table, we have a total defaulters of 248 at the beginning of 2021. By the end of 2021, the remaining defaulters is 162, which shows that the number of defaulters has been decreased by 31%. Since there are still remaining defaulters, the leprosy program needs to work hard to find these remaining defaulters to bring them back for retreatment. One of the activities also conducted in 2021 is the review of the National Leprosy Program Manual. And why we need to review the Leprosy Program Manual, it is one of the tools to be used as a guide for healthcare staff on how to detect and manage leprosy at different levels. It is outdated, and there is a need to be updated in line with the WHO new guideline on managing leprosy, and as well as our new national antibiotic guideline. After doing this activity, we have developed a drafted manual and still are waiting finalization. So this is the activity carried out in one of the remote areas where we bring other doctors from other health departments, and we spend the whole weekend working on this manual. So our word of thanks to the participation of these doctors that we are able to provide a draft manual. As part of the service provided by the leprosy program, we also provide skin clinic scheduled 2 times a week. This is one way of allowing anyone with skin problems to come and have their skin checked, and leprosy could be detected among them. The bar graph shows the number of people visiting the skin clinic and the number of new leprosy cases detected among those who came for the clinic. Now we come to the outcome of each activities. The pie chart shows how each activity contributes to the total number of new cases detected in 2021. By looking at the pie chart, voluntary reporting has contributed 64.6%, and this could be the result of awareness campaign and skin clinic, which allows people to come voluntarily to have their skin checked. Referred cases has contributed 13.8%, and this could be the result of building capacity of health staff, which enables them to identify signs of leprosy and to refer them to the leprosy unit. School screening and contact tracing have contributed 8.1%, while population screening have contributed 5.6%. After doing all the activities as listed in the previous slide, those are some of the lessons that we learned after doing the activities. We learned that there are still undetected cases of leprosy in the community, and the only way to find them is through active case finding, which is beneficial not only to the leprosy program, but also to these patients that they are able to be detected at early stage. Second one, we also learned that increasing leprosy awareness to the community enhances self-reporting of those with skin lesions, hence they are able to be detected and treated early. The third one is the stigma against leprosy remains an issue, where some of the cases could be defaulted at any time. However, psychological support to every patient during first diagnosis will surely reduce stigma in a way that their fears of having the disease, together with the long duration of treatment, will be alleviated and may eventually enhance patient compliance to MDT. And the last one is the follow-up of defaulters may be resulted from the defaulters may be resulted from not enough information given to patients on first diagnosis. So visiting them again and follow them up for retreatment can also give more chances for you and the patient to settle the misunderstandings about the disease. And at the same time, it may give them the feeling that they are cared, and therefore they will be willing to complete their treatment. It is best that you keep following up these defaulters and restart them on treatment rather than leaving them according to their will of not wanting to complete the treatment. Otherwise, they would remain reservoir for Mycobacterium leprae. These are some of the gaps and how to overcome those gaps. The first one is the leprosy program remains understaffed compared to the amount of work planned to be done. And we are so thankful that the Pacific Leprosy Foundation is helping us through funding the salary of 2 more additional staff to join in the leprosy program this year. And the second one is the job the geographical distribution of the islands, which make the cost of each planned activity to become high, in which our governments can afford or cannot cater for that. But our continuous support from our funding donors from WHO, DFAT, and the PLF has made the work done. This one is for the priority plan of activities for 2022. Our plan of activities are not now for change from last year. However, among those plan of activities, we prioritize which one need to be done first, maybe in the second quarter, such as incomplete activities from last year, and that is the mass screening on the Bayang. We already did phase 1 and phase 2, and we need to complete phase 3 and phase 4. The next one is the finalization of the National Leprosy Program. Like I already said, that it's in a draft and need to be finalized. And the next one is we have to keep on following up the remaining defaulters. The next one is we also have new additions to our work plan, which includes the recruitment of additional staff to the leprosy program. Like I mentioned before, we are working on this as the PLF is providing funding for the salary of these 2 staff. We have also a new project that's going to be started in the coming months, and this is a combined TB and leprosy screening to be conducted by the PEL project, but it will start first on South Tara. So it is also part of our activities as we may work together with this team. The next one is the inclusion of persons affected by leprosy, seeing that there are still defaulters everywhere, every year. I think including these patients in our plan of activities will address this issue. And the last one is the leprosy program's normal work of early case detection on South Tara and Out Islands will be continuous. We used to implement from previous years. The last one is just to extend our sincere thanks to the following donor partners for their continuous support to the National Leprosy Program. These include the Sasakawa Health Foundation, WHO, and the WHO itself, the DFAT, and the Pacific Leprosy Foundation. Without them, the program won't be able to carry out or implement the plan.
Thank you very much. We hope your dedicated effort will be a model for the other high endemic island nations. Next, I would like to invite Dr. David Pahan, Country Director of Lepra Bangladesh. We got a video presentation from him.
Hello everyone. Greetings from Lepra Bangladesh and also from Bogra Federation. My name is David Pahan. I'm the country director of Lepra Bangladesh. Sasakawa Health Foundation, Bogra Federation, and Lepra Bangladesh are working together for the greater interest of people affected by leprosy in the northern part of Bangladesh. Currently, Bogra Federation is implementing a project, COVID-19 and leprosy, an impact assessment initiative by Bogra Federation under Don't Forget Leprosy campaign with the support from Sasakawa Health Foundation, and Lepra Bangladesh is providing technical support. Bogra Federation is a community-based organization formed by people affected by leprosy. Leprosy is a neglected tropical disease and always getting least priority in the health system. During COVID-19, we have observed leprosy program has been affected enormously. We have observed mobility restriction, must maintain social distance, not encouraged to arrange in training or other social program. Patient was suffer, not able to attend in clinic for any kind of services and follow-up, not done for complicated patient suffering with reaction neuritis or ulcers. Person affected by leprosy experience vulnerable condition, deteriorating their physical condition, but also affected and mentally and economically. In this picture, we can see the female person how badly affected by leprosy. Are both hand and both feet also severely, now she is suffering with the disability. So during this COVID, Sasakawa Health Foundation have given support to especially to implement a special project with collaboration with Bogor Federation. So we during this time we have implemented the Shohomolmita project for COVID-19 community rehabilitation. That was in June 2000 to July 2000. Yeah. And also the main objective of the project was to provide advice and emergency assistance to people affected by leprosy and threatened by the COVID-19 outbreak. And another project we have implemented the COVID-19 support project for persons affected by leprosy during 2020 and 2021. The main objective of the project was people affected by leprosy will take leadership role and will carry out action of their sustainable physical, social, and economic and mental well-being. And another project, just we are implementing now the COVID-19 and leprosy impact assessment initiative by Bogor Federation. The activities done during this COVID-19 pandemic, we have actually selected the community champions, especially these community champions are either person affected by leprosy or their family members. So we train them to conduct this project, implement this project. And also we have orient the financial leaders to understand how they will take role regarding their role, and also the awareness activities among the person affected by leprosy, their family members and neighbors. And also we have some advocacy meetings in different level, the district level, sub-district level, and union level. And right side, you can see the numbers actually we reached. And also food support for the self-help group members, and including some of them also received the guest support. And also we have actually given support for the vaccination, and so that they can get vaccine from the government health center. Also distributed mask and sanitizer. We observed together the World Leprosy awareness campaign at district level. This is the slide. Here we can see the Honorable Prime Minister declared her commitment for zero leprosy with 2030 in Bangladesh. Actually, in 2019, National Leprosy Program arranged National Leprosy Conference in Bangladesh. The main theme of the conference was Zero Leprosy Initiative by 2030, which was supported by the Nippon Foundation and Sasakawa Health Foundation. This conference was arranged by Ministry of Health and Family Welfare, and more than 600 guests were invited. Honorable Prime Minister Sheikh Hasina was the chief guest. Mr. Yohei Sasakawa, Chairman Nippon Foundation, and WHO Goodwill Ambassador for Leprosy Elimination was also present and gave his valuable speech. After this conference, NLP is getting extensive support from Ministry of Health and Family Welfare. NLP is planning to put more resources in next operation plan. So leprosy should not be forgotten, because our aim is for zero leprosy, and we want to minimize the risk of disability, and also our concern is the people's life. So they should live not like other normal people. And also we want to work through the stigma and prejudice, and we want to see the one day the Bangladesh will free from stigma and prejudice. And leprosy should not be forgotten. And we have these several activities, active case finding, and also complication management. So prevention of disability, the provision of food and supply, social stigma and discrimination, address this issue, home visit, real validation, no, and also the especially counseling for mental health issues, and also we must give support to strengthen people's organization. So these are the issues we should not forget, and and also we should not forget to save our future generation. Like this picture, we are seeing the children from the tea garden area, where actually leprosy is very much an endemic. And also we must include our civil society, to get support in the, especially from different the the journalists, the businessmen, and the political leaders are there. So, and the community leaders, they can actually support in this journey. And here we can see the support during COVID-19 and some of the pictures for the orientation meeting, distribution of food, and the planning meeting. Yes. And the challenges, so what we have seen or observed, that the information dissemination, because there is a uh, actually from the government, they issued a special instruction for the social maintaining social distance, and not to arrange meeting or any social program, and also the lockdown situation also, the main reason to difficult to arrange those kind of meeting. And also the one of the challenges was the political pressure. While we are distributing the food and different the cash, we also uh, the local political leaders also requested, why not more people can get, and other non-leprosy people can also get the support. And also motivation of ensure COVID-19 vaccine, because when the government actually started to give vaccine, many people actually have a little bit fear and doubt that maybe they might or sick after getting this weakness. So actually, we have actually motivated and discuss with them, and our leaders also discuss with our leprosy affected person and the families. And so that was also one of the big challenge, and also leadership challenge, because the leader, they find themselves during this time, because it's very difficult to communicate, to work together with their fellow members, and also ensure government entitlement, because that the government health personnel, when they frequent our the federation leaders, self-help group members, they established a good relationship with the government health personnel, and suddenly when they actually transferred from that place, and then again it is a big challenge to start a relationship with them. So these are the challenges we face during this implementation. So thank you very much for your support and cooperation.
Thank you, Dr. Farhan. We hope we will continue work together to achieve zero leprosy in Bangladesh by 2030. Next, I would like to invite Ms. Maya from Nepal. She will share her views as a woman affected by leprosy. We received the video presentation from her.
रोगों की चुनौतियों पर दृष्टिकोण तो कुष्ठ रोगों के नहीं भूलना चाहिए। थ्री महामारी के दौरान विभिन्न प्रकार की सहायता। I am Maya Ranore, treasurer of Apple. I am expresses to most painful stigma and discrimination from the family, love and mainstream society. Before my presentation on behalf people affected by leprosy in India. I want to great to WHO Goodwill Ambassador, respected great right a woman big on the earth of Mr. Sasakawa for the support and available services to us by her Health Foundation and team. Also thankful the them for this great opportunity. The expresses my perspective and expresses of disease of leprosy and the relevant conveniences critical as a woman. निरक्षरता कुष्ठ रोग से पीड़ित अधिकारियों और महिलाओं का निरीक्षण है। सरकारी नियम और अपने अधिकारों के अभिन्न और अधिकारों को प्राप्त करने के लिए याचना करना ही असमर्थ है और उनके अपेक्षा के स्तर पे कम हो गई है। निरक्षर कानून आत्मनिर्भर बनाना और सम्मान के साथ जीने से रोकती है। टू इलाज कुष्ठ रोगियों से पीड़ित महिलाओं को पंजे और हाथ को अल्सर जैसे विकृति और सरकारी हॉस्पिटल में भी लापरवाही का सामना करना पड़ता है। हॉस्पिटलों में कर्मचारी कुष्ठ रोगों से पीड़ित महिलाओं को पुरुषों को लंबे समय तक रोकती है और इंतजार करवाती है। अस्पतालों में उचित देखभाल और इलाज के अभाव में महिलाओं का प्रस्ताव में भी किसी अन्य बीमारी का इलाज करने में परेशानी हो रही है और कुछ मौतें भी हो रही है। निजी क्षेत्रों में डॉक्टर कुष्ठ रोगों को नापसंद करते हैं और इलाज करने को इनकार करते हैं। कुष्ठ हॉस्पिटलों में केवल कुष्ठ रोगियों के लिए स्वास्थ्य देखभाल सेवा प्रदान कर रहे हैं। किसी अन्य उपचार की आवश्यकता में महिलाओं को सामान्य हॉस्पिटलों में जाना पड़ता है और उनको कलंक और कठिनाइयों का सामना करना पड़ता है। कुछ जगहों पर तो यहाँ तक है कि महिलाओं को अपनी जागृति के लिए स्टाफ से भी कम से कम उनके बातों का जवाब ही नहीं दे पाते हैं। संस्कृत कुष्ठ रोग और कुष्ठ रोगों से प्रभावित महिलाओं को प्रति समुदाय मानसिकता महिलाओं के स्वतंत्र रूप से आगे बढ़ाने में एक बड़ी बाधा है। शायद ये हमें लोग प्रभावित महिलाओं को सार्वजनिक समारोह में शामिल होने को अनुमति नहीं देते हैं। देखने में देने वाले विकृतियां कारण प्रभावित महिलाओं मंदिरों में पुजारियों को पूजा करने का अनुमति नहीं देना और शापित लोगों के लिए नो एंट्री कहते हैं। यहाँ तक है कि परिवार के सदस्य भी प्रभावित महिलाओं को उनका विवाह और परिवार को अन्य कार्यों में शामिल होने का मना कर देते हैं और कुछ आयोजन करने से पहले जानकारी भी नहीं देते हैं। गरीबी गरीबी में प्रभावित महिलाओं के लिए समुदाय और परिवार के भीतर सामान्यजनक स्थिति होने से सबसे महत्वपूर्ण कारण में से एक है। प्रभावित महिलाओं के लिए सभी दरवाजे बंद गरीबों से बाहर आने के लिए और अपना जीवन में हर कदम पर लापरवाही शोषण और भेदभाव का सामना करना पड़ता है। भागीदारी परिवार के सदस्य प्रभावित महिलाओं के उचित और घृणास्पद मानते हैं। प्रभावित महिलाओं और परिवार के मामलों में सलाह देने का अनुमति नहीं देते हैं। परिवार के बच्चों के साथ खेलना अनुमति नहीं देते हैं। शादी और त्योहारों में शामिल होने के लिए उसे अपने साथ नहीं ले जाने चाहते हैं। परिवार से इसी प्रकार का रवैया प्रभावित महिलाओं को मानसिक रूप से उदास हो जाते हैं और अंत में स्वयं सभी दुष्ट कॉलोनी में खुद को अलग थलग कर देती है। अवसर परिवार और समाज से अकेलापन बार स्वास्थ्य संबंधी समस्या दृश्य विकृति मानसिक बीमारी मानसिक सेवा और सामाजिक अधिकारों तक पहुंचने नहीं होने के स्वास्थ्य देखभाल सेवा नौकरी का अवसर में भेदभाव शिक्षा प्राप्त करने के रास्ते में बाधिया और एक खजाने में समस्या रहने की जगह पर महिलाओं पर पीड़ा होती है। अधिकार फिर भी अलग अलग समय पर स्थान पर जिस तरह से सभी सार्वजनिक गमों पर प्रभावित महिलाओं के साथ व्यवहार किया गया है उन्हें उनके मानवाधिकार का गंभीर उल्लंघन माना गया है। इस प्रकार में उनका गरिमा को छीनी कर देता है। कल्याण आत्मनिर्भर के लिए पुनर्वसन माध्यम से सहायता आवश्यकता प्रभावित महिलाओं का सम्मान और सामान्य हासिल करने के लिए वित्तीय सहायता प्रदान करने की प्राथमिकता देना चाहिए। एनजीओ को पुनर्वसन के लिए विशेष योजना चलाए। मुख्य धारा में शामिल होने के लिए कुष्ठ रोगों से प्रभावित व्यक्तियों के खिलाफ भेदभावपूर्ण कानून को निरस्त करना चाहिए। अन्याय मानव अधिकार के सेवा डोंट फॉरगेट लेप्रोसी अन्याय मानव अधिकार के स्वभाव में घोषणा में गया है। सभी मनुष्य स्वतंत्र और गरिमा और अधिकारों में सामने पैदा हुआ है। इसमें कुष्ठ रोगों के पीड़ित प्रत्येक व्यक्ति शामिल है लेकिन फिर भी कानून सामाजिक आर्थिक भेदभाव बन रहता है और कोई दशक तक ये जारी हो सकता है। कलंक और भेदभाव यहाँ तक है कि विकलांग लोगों को प्रभावित लड़कियों से शादी के लिए स्वीकार नहीं करते हैं और कुष्ठ रोगी से प्रभावित लोग बच्चों को भी स्वीकार नहीं करते हैं। बहुत से प्रभावित माताओं को उनके घर से बाहर रोक दिया जाता है और कुष्ठ रोगों के कारण अपने बच्चों के देखभाल अधिकार से वंचित दिया जाता है। मुख्य धारा में लोग कुष्ठ कॉलोनी में रहने वाले लड़कियों को शादी के लिए स्वीकार नहीं करते हैं। पुरुषों के साथ तुलना करें तो कुष्ठ रोगों से पीड़ित महिलाओं को अपने घर और समुदाय से बहुत कलंक का सामना करना पड़ता है और शारीरिक और मानसिक रूप से समस्याओं को सामना करना पड़ता है। महिलाओं को अपने बच्चों को बेदर्द नहीं करना है। आरपीडब्ल्यू एक्ट अधिनियम आरपीडब्ल्यू एक्ट अधिनियम 26 के तहत हमें लोग मोटर श्रेणी में डाल दिया गया है। हमारे लिए बड़ी प्रतिस्पर्धा है। अधिकारों से सरकार कार्यालयों जैसे डीएलओ एसएलओ कार्यालयों में मेरिट द्वार हमारे आवश्यकताओं के प्रस्तुत करने के लिए जाने के लिए भी सुलभ नहीं है। मेरा कहना है ये है कि अधिनियम तहत कागज पर लोग भुगतते हैं लेकिन व्यवहारिक रूप से नहीं। गया अधिनियम राज्य सूची में सूचीबद्ध थे। केंद्र सरकार के राज्य को देखने होगा तो अधिनियम को ठीक से लोग किया गया है। महामारी के दौरान विभिन्न प्रकार की सहायता कुष्ठ कॉलोनी के द्वारा उनके समस्या और स्थिति को पहचानने के लिए कोविड-19 के जन जागृति कार्यक्रम 3 कार्यक्रम और कोविड-19 राहत के लिए खानदान वितरण, बड़ी राहत के लिए खानदान वितरण, सामाजिक सुरक्षा सेवाओं, मास्क और सैनिटाइजर का वितरण, कोविड-19 का परीक्षण द्वारा स्वास्थ्य देखभाल सेवा और अल्सर देखभाल ड्रेसिंग समग्र और टीकाकरण प्रदान करना, कोविड-19 का आवेदन किया और प्रदान किया, जीवन शैली रोग पहचान शिविर, कुष्ठ कॉलोनी में रहने वाले बच्चों को ट्यूशन सुविधा प्रदान करना, सकारात्मक समाधान, हमें बेहतर निराकरण तंत्र और अधिक प्रभावशाली स्वास्थ्य प्रणाली की आवश्यकता है। 2 जिला स्तर पर एक त्वचा विशेषज्ञ और कुष्ठ रोग से निवेदन और संपर्क और प्रबंधन अनुभवी व्यक्ति उपलब्ध है। 3 कुष्ठ नियंत्रण स्कूल और कॉलेज में स्वास्थ्य शिक्षा के साथ और अधिक निकट से जोड़ना जाना चाहिए। 4 कुष्ठ रोगों से संबंधित विशिष्ट विज्ञान तथा अधिकार पर समुदाय भागीदारी के साथ सांस्कृतिक रूप से सहकार्य हस्तक्षेप विकसित करने की आवश्यकता है। 5 सामुदायिक जन जागृति की आवश्यकता है और मामलों के शुद्र प्राप्त लगाना उपचार के अनुकूल और सामुदायिक आधारित पुनर्वसन में सुधार के लिए भागीदारी आवश्यकता है। 6 नया स्टाफ ऑफ के लिए कुष्ठ रोगी से प्रभावित महिलाओं के लिए स्टाफ लोन भागीदारी और समावेश। 7 कुष्ठ रोगी से प्रभावित महिलाओं के रोजगार के अवसर प्रदान करने के लिए सरकार द्वारा नया प्रोत्साहन योजनाएं। 8 कुष्ठ रोगी और भेदभाव के संबंध में सोशल मीडिया रेडियो में जन जागृति। 9 कुष्ठ रोग से प्रभावित महिलाओं के लिए तकनीकी जैसे विभिन्न प्रशिक्षण कार्यक्रम शुरुआत और जो समाज में बेहतर सम्मानजनक जीवन जीने की मदद करेगी। 10 कुष्ठ रोग के बारे में कुष्ठ जन जागृति और कोविड-19 और कुष्ठ रोग के बीच अंतर लोगों में जन जागृति कुष्ठ रोग से कम संक्रमित हो और 95 लोगों में इनकी प्रतिरोधक क्षमता है। 11 कुष्ठ रोगों के प्रभावित महिलाओं के लिए लिंग संबंधी भेदभाव के बारे में लोगों को शिक्षित करने के लिए सोशल मीडिया पे सामाजिक जन जागृति। थैंक यू सो मच।
Thank you, Ms. Maya, for sharing your views. The voices and the action of women affected by leprosy should not be forgotten. Next, I would like to invite Ms. Yuriati from Permata, Indonesia. We got a video presentation from her.
Introduce, my name is Yuri, the chairwoman of Permata Indonesia for South Sulawesi region. Permata is an organization of and for people affected by leprosy in Indonesia. Allow to share some information related to leprosy issues in Indonesia that should not be forgotten. Talking about issues of leprosy in Indonesia consists of several things, namely 1. Stigma, discrimination, 3. Health insurance and referral system, and 4. Leprosy control program. Most Indonesian people still view leprosy as hereditary, of course, a disease caused by things committed in the past or witchcraft, so that there are still those who go to traditional healers. Many also think that leprosy is incurable, where their community considers disability caused by leprosy as evidence that it cannot be cured. The stigma does not only come from the community, but also cause stigma within the person affected by leprosy. This self-stigma can come in form of loss of self-esteem and self-confidence, feeling afraid of being discriminated against, feeling guilty, ashamed, hopeless, despairing, or angry because they cannot accept themselves having leprosy, depression, and even attend suicide can be the consequence. Discrimination is a result of the high discrimination. People affected by leprosy often experience discrimination. For example, being rejected or expelled at work or school, rejected in public place, abandoned or separated from a life partner, and also having difficulties to find a life partner. Sometimes a separate, isolated hut is made or people are locked in the house because the family feels ashamed to have a family member affected by leprosy. In fighting stigma and discrimination, Permatas also conduct dissemination of correct information about leprosy. These activities are in the form of talk shows on TV and radio, leprosy campaign by distributing brochures, stickers, and banners, using social media and print media, as well as conducting outreach in school and in the community. In addition, we also provide assistance to patients on treatment, provide peer counseling, and empower people affected by leprosy to increase their confidence. Health insurance and referral system. Many people affected by leprosy don't have health insurance. In addition, the court referral system is a major barrier to access healthcare because it requires people to report to the primary healthcare facility first. From there, they can be referred to the district hospital, but it is difficult to get referred to the former leprosy hospital. In addition, the health insurance policy can only cover treatment for 3 days. While we know that often longer treatment is required, these things sometimes make people affected by leprosy do not want to be referred and instead surrender to their fate. Since many parts of Indonesia have been declared eliminated from leprosy, the intensity and quality of the control program has decreased. Currently, NDT drugs are sometimes not available at the health center anymore, so that treatment is interrupted. There are fewer competent leprosy offices because of, of retirement or transferal to other departments, while training of new offices is lacking. In the hospitals, there are there are no reconstructive surgeons for leprosy anymore. Plus, the current COVID-19 pandemic has caused the government attention to this crisis because health workers are focusing on handling COVID-19. To overcome this problem, Permata together with YDTI carries out advocacy to the government and the former leprosy hospital to increase their service. We are currently involved in organizing training for reconstructive surgeons. We have been visiting very many people affected by leprosy to find out their needs and advocate with the local government for support. Mr. Asif Sinaga on February 20, 2022 wrote in an article, if only the attention to the leprosy were the same as for COVID-19. If this will happen, then I believe the negative view of leprosy will disappear. Indonesia has achieved the elimination of leprosy, but there are still so many problems. We hope that the government will continue to pay attention to this problem in a comprehensive approach. An intensive approach is needed through various media that can increase public knowledge, create friendly and quality health service for leprosy, try to involve people affected by leprosy in activities carried out in the community, create inclusive employment opportunities, and others. This is what I can convey regarding the problem or obstacles that we experience as people affected by leprosy in Indonesia. Thank you.
Thank you very much, Miss Yuli. It's a very good presentation. Stigma and discrimination against persons affected by leprosy is one of the main leprosy issues we need to address. So young leaders like you have a great potential to influence young people. Thank you very much. Next, I would like to invite Mr. Yohei Sasakawa, WHO Goodwill Ambassador for Leprosy Elimination, to provide his message. Please, Mr. Sasakawa.
皆さん、元気なお顔を拝見し、また素晴らしいスピーチを聞かせていただいて、本当にありがとうございました。キリバスのエレイさん、一緒に船に乗って患者さんを探しに行きましたよね。大変私にとって懐かしい思い出であります。また、バングラデシュのバハンさん、ハシナ首相もご出席くださいまして、一緒にハンセン病の大会をバングラデシュでやり、またその後、あなたが中心になって、回復者の皆さんの会議を開かれたことも思い出されます。また、インドのマヤさんは、もうインドの回復者の団体であるエーパルの立派な幹部の一人としてご活躍いただいておりますね。そしてインドネシアのユリさん、確か2018年だったと思いますけれども、お会いをいたしました。ペルマータでご活躍をいただいております。今、それぞれの皆さんが素晴らしいお話を聞かせていただきました。何よりも最初のインド笹川ハンセン病財団シルフと言っておりますが、タルンダースさんはインドを代表する大きなこの企業の団体の指導者として長く活躍されておりましたが、私がハンセン病の制圧活動をするということで、ご協力をいただきましてね、今も会長を務めて、努力をしていただきまして、今日はお忙しい中、素晴らしいスピーチをいただいてありがとうございました。こういうコロナのためになかなか皆様方と直接お会いする機会がないわけでございますけども、しかしこういう近代的な道具が発達しまして、Zoom とかこのオンラインで皆様方のお話を直接聞けるということも、逆に言うと大変便利な時代になったということも言えるのではないでしょうか。笹川保健財団ではこういうコロナの時期でも決して、ハンセン病、レプロシーを忘れてはいけないということで、Don't forget leprosy というキャンペーンを毎週のように 世界中を対象にして活躍をしていただいております。多くの方々にこのハンセン病、レプロシーの本当の姿を、回復者の皆さんやそれを支える医療関係者の皆さんの真実の声を聞いていただいて、そしてハンセン病レプロシーに対する正しい知識を持っていただければ、この病気をなくすことができるんだということをご理解をいただきたいと思い、毎週のようにこのZoom を使って、多くの方々に語り続けているわけでございます。本日は皆さん方の毎日の活動がいかに困難な中に勇気を持って一人でも多くの皆様の病気の発見と、そしてこの偏見や差別をなくすために、特に回復者の皆さんが自信を持って活動をしていらっしゃる報告を受けまして、大変心強く思いました。これからは回復者の皆さんがこのハンセン病レプロシーにまつわる偏見や差別をなくす主人公、主役として、そして社会を変える指導者として活動をしていただきたいと私は強く願っております。キリバスのエレイさんは本当に少ない。確か私キリバスではハンセン病レプロシーの担当者は3人か4人しかいらっしゃらないと思うんでございますが、私は皆さんの活動の事務所の掲示板を見たことがありますが、本当にぎっしりと予定がそこに書き込まれているのを拝見しました。いかに毎日のようにこの患者さん探し、そして患者さんに対する薬を差し上げること、あるいは激励をすること、励ましをすることに努力されている姿に私は感銘を覚えたことがございます。これからも皆様方の精力的なご活躍を期待したいと思いますし、私は皆様方に十分な力は発揮できませんが、常に私は皆様方のそばにいて、共にこの歴史的な病気でありますハンセン病、レプロシーをなくすための活動を皆様方と共に続けていきたいと願っておりますし、また活動の中でお困りの点がございましたならば、ぜひとも笹川保健財団にご連絡をいただきたいと思っております。何か私たちがお手伝いをするアイデアや考えがそこに生まれ、皆様方のお助けになることもあろうかと思いますので、どうぞ遠慮なく笹川保健財団にご連絡をください。本日は誠にありがとうございました。私自身も大変元気づけられました。皆様と共にドントレプロシーの活動をさらに強力に進めてまいりましょう。
Thank you very much for your message, Mr. Sasakawa. So let's move on to the Q&A session. Now I want to invite Professor Takahiro Nandi, Executive Director of Sasaka Health Foundation, to facilitate the session. Professor Taka, floor is yours.
Thank you very much, Chikako. First of all, we appreciate the audience that you sent us so many questions. But as we usually do, since our time is limited, I hope you would permit us to pick up a few questions that you sent us in advance. So I want to invite the first person, who is Mr. Udai Takao. Mr. Takao, are you there?
Yes,
All right. So how are you doing, Mr. Takao?
very good. We are working very hard and fine.
All right.
Hi.
So,
Gurudev.
so please go ahead of asking a question to Mr. Sasakawa.
Yeah. I am very much thankful to you for giving me this opportunity. I got a simple question. For last 45 years, we are working to control leprosy or eradicate leprosy or even eliminate leprosy. But still, we have to work along. So my simple question is it possible to eradicate leprosy by 2030? And what step we should take to achieve this goal? Thank you.
ダイダカールさん、しばらくぶりにお目にかかって、大変元気なお姿を拝見し、また力強い声を聞かせていただきまして、ありがとうございました。あなた自身がインドにおける回復者の皆さんがまだまだ自信もなく、そしてエイパルという回復者の皆さんのインドにおける団体ができる前から、あなたの本当にこの心のこもった回復者の皆様への支援活動というものを私は長くずっと見てまいりました。あなたのレプロシーの患者、回復者に対する深い愛情をいつも拝見しながら、私はあなたのようになりたいということで、私はあなたの背中を見ながら活動をしてきた歴史であります。で、ただいまは30年までに根絶は可能でしょうかというご質問を賜りました。大変難しい質問をいただきました。日本の言葉に予定は未定にして決定にあらずという言葉がございますが、しかし2030年という目標に向かって努力をするということが2030年にゼロにするという目標に向かって全ての方が努力をするという目標設定は私は正しいものであると思います。なぜならば、WHO で我々が1万人に1人に患者さんをしようという目標設定があったからこそ、今日の患者数を激減させることができたわけでございます。しかしながら私はよく皆様方にお話申し上げますが、100マイルの道のりは99マイルをもって半ばとするということを申し上げて きました。今まさにインドにおけるハンセン病、レプロシーは皆様方の努力によりまして99マイルまで来ました。しかしこの残りの1マイルは大変難しいものであることは事実でございますが、これだけ、メディアが発達し、またスマートフォンというような近代的な道具によって、Twitter や Facebook もできる時代になってまいりました。考えてみればことは簡単なことでございまして、すべての人たちが時々自分の体を、あるいは家族の体のスキンチェックをして、白いパッチがあれば、これはレプロシーかもわからないということが分かれば、薬はタダであるわけです。風邪をひけば喉が痛かったり、鼻水が出たりして風邪になったなと自覚症状があるわけでございますが、このレプロシーの一番難しいところは、痛くも痒くもないこの自覚症状がないというところが最大の問題でございますから、明日病院に行ってみよう、明後日病院に行ってみようといううちに1年2年が経過してしまうということもございます。ですから全ての人々にどのようにしてこのハンセン病、レプロシーの初期症状を知っていただくかということが、これをゼロにする最も重要な私は方法だと思っております。従いまして、今私はいろいろな各国でテレビやラジオに出まして、今テレビを見てる人、ラジオを聞いてる人はすぐこの番組が終わったらスキンチェックを家族でしてくださいということをお願いをいたしております。そういう意味で病気を治す薬がすでに発見されているわけでございますので、この単純なことが単純であればあるこそ逆に難しい問題ではありますが、すべての国民がそういうことを知っていただければ、これはゼロにすることは不可能ではないわけでございますが、ただ問題はこの治療が遅れたために障害を持ってしまった時が、これが問題でございまして、そこにウダイ・ダカールさんもご承知のように、偏見や差別という別の社会が持っている病気が発生してくるわけでございます。しかしこれすらも交通事故で障害を持ったことと何ら変わりはないわけでございますが、長い間人類がレプロシーに対する旧約聖書の時代から神様の罰だとか、遺伝する病気であるとか、感染力の強い病気であるとかという間違ったイメージを頭の中に持ち続けているこの病気、社会の病気を治していくということは並大抵のことでは私はないと思います。特にこの障害が あるために、そのように社会の人々から見られるわけでございますから、障害がなければ、そのような偏見や差別はなくなる、わからないわけでございますから、やはり早期発見、早期治療をするような努力をしなければ私はいけないと思いますし、また現在回復者の皆さんがウダイ・ダカールさんの力で、特にインドでは、大きな組織になってまいりました。そして、恥ずかしいとか、あるいは新たな差別を呼ぶということではなくって、彼らが率先して、活動を開始してくれたということは、歴史上近年までなかったことでございますので、そういう回復者の皆さんを組織化し、指導し、激励をしてきたのがウダイ・タカールさんであると私は思っておりますので、引き続きましてお互い力を合わせまして、今あなたからの質問がございましたが、やはり努力を続けるということ以外に、私は問題の解決はないと思いますし、必ずやこれは解決できるという強い信念を持って、ウダイ・タカールさん、一緒にこれからも活動してまいりましょう。
Thank you very much, Mr. Sasakawa. I forgot to, briefly, introduce the background of Mr. Takao.
Yeah, thank you very much, sir.
For information, Mr. Takao, he is a long-time advisor of the Association of Persons Affected by Leprosy. So thank you very much, Mr. Takao.
Thank you very much. I'm very happy, and I think his guidance and will be most appreciated. And if I personally feel that if we work on his line, achievement to eradicate leprosy by the end of 2030 may be possible. But for that, general awareness should be there. We have to change the mindset of our people. And I'm sure that association of people affected by leprosy will have to play a much more important and aggressive role in this area. Thank you very much for your word of appreciation. Thank you.
Thank you very much, Mr. Takao. So next, I want to invite Ms. Nadira from Indonesia. She's a leader of the NGO called Jalan, which is facilitating the younger generation to visit the leprosy settlement. So Mr. Nadira, are you ready for asking a question to Mr. Sasakawa?
Yeah. Good afternoon, everyone. Good afternoon, Mr. Takahiro and Mr. Sasakawa. I'm Nadila from Jalan, or previously known as Leprosy Care Community Indonesia. So I would like to ask how crucial is prevention of disability as an effort to eliminate the leprosy? And in the context of prevention of disability, what have been done and what should we do in the future? Thank you.
インドネシアにこれから毎年6回訪問して、インドネシア各地を回って皆様方と共にこのレプロシーをクスタをなくすための活動をしますと皆さんにお約束しながら、コロナになってしまったので今行けないのは大変残念なことでございますが、ご承知のようにインドネシアはブラジル、インド、ブラジル、そしてインドネシアが3番目にレプロシーのクスタの多い国であることはあなたもご承知の通りでございます。しかしながら私たちはインドネシアから新しい 活動を始めました。それはテレビやラジオに出演をさせていただきまして、お医者さんと私と、そして回復者のペルマータの回復者の代表と3人でテレビやラジオに出るように努力しております。そしてそこで、レプロシー、クスタの正しい知識を理解をしていただき、何よりも優れているのはテレビを見てる人、そしてラジオを聞いてる人から質問を受けるということなんです。そしていろいろな質問がありますが、例えば今妊娠をしていますが、生まれてくる子供はレプロシー、クスタになるでしょうかというようなお母さんの心配の質問もございます。また、この笹川さんがおっしゃったように、体にパッチができたら、それはすべて、レプロシー、クスタでしょうかという質問もあります。その時には少しこういうペンだとか硬いものでそこを押していただいて、痛くなければクスタの可能性がありますよというようなお答えもさせていただいて、直接国民の皆様、住民の皆さんと話ができることに努力をいたしております。従いまして、クスタ、レプロシーの最大の問題は、障害を持つことなんです。障害があるために、社会の人々から偏見や差別を受けるわけですから、障害さえなければ、風邪をひいて治った、あるいは結核になっても治ったということで、何ら人々から偏見や差別の対象になりません。ですから、障害にならないように早く薬を飲むことが肝心なんですが、そのための条件はご承知のように、テレビでもラジオでも言いますが、終わったらすぐに家族で体のチェックをしてください。白いパッチができてたら、レプロシー、クスタの可能性がありますよと。これは痛くも痒くもないんですと。その時点でお母さんが子供を見つけ、お父さんが子供を見つけてくれたならば、薬を飲めば何の障害もなく治るわけでございますから、これは人々からあの人はクスタになった人だ、レプロシーになった人だというふうに思われなくて、自然に治ってしまうわけでございますから、障害が出る前にどうやって早く発見するかと。ここがまた難しいことで、白いパッチができても痛くありませんから、なかなか病院に薬をもらいに行かないんですね。風邪をひいたら喉が痛いですから、あるいは咳が出ますから、すぐ風邪をひいた病院に行こうということになるんですが、クスタは痛くないですから、1年も2年もそのまま放置してしまうというケースが障害につながってしまうわけでございます。 障害になってしまうと、なかなかその障害を治すことは技術的にも難しいことでございますから、これを見た社会の人は、あの人はクスタになってるということで、偏見や差別の対象になってしまう。本来ならば、障害があってもですね、交通事故で障害を持った人もいるし、いろいろなことで、生まれながらで障害を持った人もいらっしゃるんですから、健常者と同じように、生活をする権利があるんですけども、残念ながら人々にはまだそういう頭の中に人々を差別する気持ちが残っているということは、正直認めなければ私はいけないと思っております。従いまして、障害が出ない段階で治すことに皆様方のご協力をいただきたいと思います。ナディラさんもぜひこの活動に協力をしてください。お願いいたします。
Thank you very much, Mr. Sasakawa. As Mr. Sasakawa has mentioned, in 2017, if my memory is correct, he is committed to the Minister of Health in Indonesia to visit all the endemic provinces of Indonesia. But due to COVID, he has not yet completed. So I'm sure that after COVID is stable, he will be back to Indonesia very soon. So he will have opportunities to interact with the organization, Ms. Nadia. So thank you very much. So
Thank you.
Okay, so let me invite one more person who is Ms. Sujata from Enera, Nepal. Ms. Sujata, are you there? All right, so you ready for asking a question?
Yes.
Okay, so please go ahead.
Good afternoon, everyone. First of all, thank you for this opportunity. So my question for you is, what are your upcoming plans for leprosy prevention and control across the globe?
ありがとうございます。本当にネパールにも私はもう何回行ったことでしょうか。特に国内の治安が悪くてですね、なかなか地方に行けないでもどかしい時がたくさんありましたけども、国が落ち着いてビハールの国境地帯、特に患者さんが多いところでございましたけども、行けるようになりました。ネパールは小さな国ではありますが、本当にこのレプロシーをなくすために活動をなさっている多くの NGO が存在しますし、また回復者の皆さんの組織も数多くあることも私は知っております。たびたび訪問するために皆さん方が積極的に参加をしてくださることに、本当にネパールにおける皆様方の活動には私はいつも敬服をいたしております。残念ながら現在コロナというような感染症のために私たちが行くことができません。しかしながらこういう中でこの近代的な道具が使われるようになりましたね。この今やっている Zoom ですとかオンラインですとか、あるいはもう皆様方一人一人がスマホを持って Facebook もできる時代になってきましたから、皆様方一人一人がメディアの役割を果たせるんですね。どうぞもうあなたもおやりになっていることだと思いますけども、 どんどん発信していただいて、友人や知人にこのレプロシーについての正しい知識を、私はこういう仕事をやってるんだ、こういうことが単なる病気なのにいまだに神様の罰だとか、遺伝する病気だとか、神様の呪いだなんて言っている間違った人が世の中にはたくさんいるのよねと。こういうものをこんなに、科学が発達した時代なのにこんなことを言ってる人がいるのよと。皆さんもどうぞ友達にこういう間違いは正していくということをFacebook で広げてくださいよというようなことも、皆さん一人一人がすでにメディアになってるわけでございますので、そういう活動をやっていただくということも大変有力なことでございますし、もちろん私自身は現場には問題点と答えがあるというのが私の人生哲学でございますから、コロナの問題が収束しましたならば、私はネパールを訪問して直接あなたにお目にかかって、そして共に現場での活動を再開したいと心待ちにしております。
Thank you very much, Mr. Sasakawa. Miss Sujata, Mr. Sasakawa is correct. Before the pandemic, Mr. Sasakawa had a plan to visit Nepal in 2020, but as you know, due to COVID, we have postponed. So I'm sure that the visiting Nepal is one of his priorities. So you have a chance to meet him in the near future. So thank you very much, Ms. Sujata.
Thank you very much for this session. Thank you. We hope to see you soon in Nepal.
Okay, so I think time is running out now. So I think I want to close the session. So I want to hand it over to Chikako.
Thank you very much. Thank you everyone for joining us today. Our next webinar will be held in May, and we look forward to welcoming you again. So thank you very much and have a good day.